Project Director of Samvedna Senior Care. We've been working with elderly since the past 6 years, working in areas of healthy aging and dementia care. And we've also been focusing since the past 2 years on mental health related issues. And today we're going to be talking about the dilemmas associated with social isolation of elderly during COVID times. And before I introduce the panelists, I would just quickly like to go over a couple of house rules. So we will be keeping the participants on mute whilst the panelists are speaking. If you have any questions or comments, please do put them into the chat box, and we will read them out when we go to the question answer section. If you're unable to type your questions or comments in the message window, you can raise your hand and we will unmute you. There's a raise hand option below, and you're welcome to then ask your question and share your comments. So with that, it takes. I have a lot of pleasure in introducing our panelists for today. I really can't find enough words to extend my gratitude to Mike Splain for having joined us. I know it's very early in the morning from where he is. He is the owner and principal of Splain Consulting and former director of State Policy and Advocacy Program, the National Office of Alzheimer's Association, Washington, D.C., where he's worked for more than 20 years. I mean, and he has a wealth of experience that I just can't begin to describe. He's known worldwide for bringing the real face of a problem into the policy arena to yield success with policy influencers. And it's a real honor to have you with us today. So thank you so much for taking the time out to be here for this webinar. I'm also honored to introduce Mrs. Vidya Shenoy. She's the Secretary General of Alzheimer's and Related Disorder Society of India, the Honorary Secretary, Mumbai Chapter, and a panel member on Maharashtra State Mental Health Authority, Government of Maharashtra. She's on the board of many medical social causes, practicing integrative therapies for seniors with Alzheimer's and dementia, and children with special needs. She also runs the Specialized Dementia Daycare Center in Mumbai, Universe of Memory, Smriti Vishwam, that has international certification. She's organized several talks and events to spread dementia awareness and work towards a dementia-friendly community, and is incredibly passionate about her work. Definitely these very brief introductions don't do justice to the depth of experience that our panelists have. And I would really like to thank them for taking time out to join us today. I'd also like to welcome several senior members of the I would like to take this opportunity to welcome several senior members who've joined us for today's webinar. Thank you for joining us, ma'am, Meera ma'am, and Narendra ji. And I would not be able to mention a personal thanks to everyone else, but thank you very much for everyone for joining us today. We also have a number of caregivers who have joined us, and this webinar is as much about hearing the kind of perspectives and challenges which they are facing whilst in the midst of these very different, very unusual and unprecedented times. So with that, I would like to invite you, Mike, who's a real global expert in dementia policy and advocacy, to share your perspectives on the challenges which are being faced by elderly due to COVID restrictions, And I'm also very curious to know a little bit more about the online community, which you've recently launched for and by persons living with dementia who live alone. And I think this is something which you've mentioned you've launched very recently. So looking forward to hearing more about that. Over to you, Mike.
So let's see if the magic works. All right. Good audio. Well, thanks. And I feel like I've had the privilege of being on site in India for a couple of epic trips. I feel like I'm making my third trip to India, so it's quite special. I want to start with talking about my mom. My mom's 88. She's pretty fragile. She lives with one of my sisters, and sometimes she takes care of my sister. Sometimes my sister takes care of her. My sister is disabled from a medical accident, and my mom is the youngest of her family, of birth family of 6 brothers and sisters. She is the youngest of all of her first cousins that numbered 20, and she's the last one. She's the last one. And that weighs on her. That creates there's a social isolation that she experiences that I can't really get my head around because I'm not living it. So when I think about the topic of social isolation, I think we need to think about um, what part of it is inevitable and what part of it is, I guess it's not really a word, but what part of it is evitable or changeable. Because I think some of mom's social isolation is inevitable. She's the last of her generation. And in fact, in these COVID times with things like forced social isolation, all the chaos that's come with COVID, it's been interesting to talk to mom. We have a little controversy in our country about whether or not we will hold our election by mail. That may have made international news because of who makes that news. And I turned to my mom and I said, "Didn't your brothers all vote by mail during World War II from all over the world?" You know, I don't have that experience, and my mother has less in common. The only thing she really has in common with her 5-year-old great grandson is blood and name, right? So some social isolation, all made worse by COVID, is inevitable. Let me just talk about some of the social isolation that I don't think we can change very easily because it's just driven by the unseen hand of demographics. Um, the one social isolation among older people is forced on us because women, sadly or happily, women outlive their men. Women in many cultures, most cultures around the world, will face some years, if they have been married, they will face some years of widowhood, which can bring with it a social isolation that their younger spouses will never know. In some countries, we have high rates of divorce, particularly among baby boomers, and increasingly among younger generations, persons who were never married. And if marriage and if marriage is kind of the glue of building social connections, people are going to be either have checked out of that experience in one way or another. Policies in many countries have been driving small families, and small families that are scattered with educational opportunities and economic opportunities. Small families that are scattered, and this whole nuclear family model that many countries, as they get wealthier, tend toward, create its own demographic move toward more social isolation. Of course, there's a terrible set of jokes going on about how introverts are actually enjoying being isolated during COVID. And then along comes technology, and we just can't get out of not being isolated. Darn it! But I think there is some element of truth to how privately and how socially disengaged some boomers wish to live. They wish to live on their own little island of narcissism. Did I say that about baby boomers? Oh, maybe. So what I think, like we do in good dementia care, what I'd like to just push on a little bit is how could we deal with harmful social isolation? What's going on to reduce the excess disability of social isolation, of the changeable social isolation? There's a major aging organizations in the West, such as the American AARP, and it's like in Europe, have been running around for the last, I don't know, 5 to 7 years saying that social isolation is as damaging to our health as smoking 15 cigarettes a day. And all that does is remind us reform smokers about how much we miss cigarettes. No. But I think there are these tropes, there are these translations of public health truths into catchy phrases that are sticky. We get caught up in them, and we repeat them, and we start to internalize them and believe them. And there is no doubt, even at the level of how our brains work, social isolation can be harmful. We now have increasing evidence that social activities are not only about how our brain works, but actually how our brain is built. Really interesting findings from neurobiology. We all know, and COVID has exacerbated this all over the world. We all know that aged care, when it is disintegrated from community, doesn't do as well, doesn't prosper. When we have isolate our fragile elders into care communities that are not integrated or seen as part of their community, somehow seen as other. And in the United States, this has really led to tragic difficulties when COVID is hit, because there are communities in this country where folks didn't even know that they had a large elder care facility in their communities that was under threat. That's disintegration. And when crisis comes, that disintegration and isolation leads to difficult results. Of course, we have also the opposite, right? We have great examples of aged care, which is um, developed in a multi-generational way, and those seem to be doing much better. But we also see this, a couple other things we've seen in kind of the difficulty of aged care. They're at the absolute end of the supply chain. In the United States, and that's what I know best, but in the United States, our government stockpile of emergency equipment that has gone out to care communities, nursing homes found themselves at the absolute end of the supply chain for personal protective equipment. And in fact, when they got a shipment, there was a major shipment from the national stockpile. Most nursing homes got pediatric masks from the national stockpile 3 weeks ago. You could look it up. It's just a consequence of this disintegration. One other thought I'd say about aged care communities and COVID that is actually kind of hopeful. I believe, and we are looking into the data on this, but I believe some of the elderly death rate in some care communities is a result of careful attention, including in hospitals, by the way, careful attention to advanced directives. There's been a picture created of the dramatic emergency room scene where the good looking doctor and his faithful nurse are deciding between whether the 88-year-old man with dementia gets the ventilator or the 18-year-old star athlete with his whole life in front of him. I think what's more going on, and we're looking at the data to this, is that in fact that 88-year-old has an advanced directive, a living will, a power of attorney. They have an advanced directive on place, and increasingly with electronic medical records accessible by their healthcare providers in a pinch, in an emergency. And that in fact what we're seeing is a lot of comfort care, palliative care, thoughtful care of people who contract COVID according to their wishes. So it's not all, it's a mixed bag. It's not all ugly out there when it comes to what's happening, the isolation of aged care. Just a few words about dementia. It's I think what we found is it's how we react and how people are reacted to when they announce or tell their friends and family that they have a diagnosis of some form of dementia that will really lead to whether or not they're isolated, their rights are violated. It's really not the disease in and of itself, but it's others' reaction to the disease. And the very loud and very vital part of the dementia community that are people with dementia, increasingly as their voices are heard, we learn this from them directly. The dementia friendly community movement, which is really an awareness raising movement, has done more to destigmatize and demystify dementia. The far end of that, though, makes it sound like dementia is just a head cold, and it's not. It's a deadly serious, difficult disease and path for both the person with the disease state and the caregiver. And we can't lose track of that as much as we want to promote the rights and interests and the acceptance of people with dementia in our communities as vital parts of our communities. We've been working I just want to mention a little bit about live alones. In the United States, because of our unique demographics, we are now in a situation where probably 1.5 million persons living with dementia live in a single person household. That's a lot of isolation, my friends. And COVID has made it infinitely worse. Um, and many of these folks have tough lives. Many of them don't know they have dementia because we have miserable diagnostic rates and even worse rates of diagnostic disclosure, even when medicine is available. But we have 1.5 million people living alone with dementia, and they almost only get thought of as crisis. And in fact, many of them are living planful, thoughtful lives in spite of their disability living alone in their communities. 2 years ago, we started running and we've done about 10 one-day summits about issues around people with dementia who live alone at the community level to do both visibility and awareness raising, but also to do action planning. And one of the constant themes of those summits has been, what can we do? We know how to build a crisis table to deal with the terrible cases that come our way because of protective services or police and fire department happening upon an elder with dementia that's in terrible straits or meeting them at the emergency room. We know how to build a crisis table for the people that need massive amounts of support. By the way, that crisis table sometimes doesn't think about whether or not that person could be supported back in their home. Just a point. But at any rate, we know how to do that. But what we know less about is how can we work upstream and not deal with crisis. And this is my last point, and then I'll turn over the microphone. And so what we've started is an online community. Itself is it's inevitable because of the times, but it's also relying on people both having technology and being able to use technology. So we know the number of people we'll reach is limited, but we've launched an online Facebook group to which people must apply for admission that will be of, by, and for people with dementia who live alone. We plan to provide them curated, useful information that is as directed to their particular circumstance of living with dementia as we possibly can. So we have a curator, and then we have a moderator who watches or lurks, I guess is the fancy word, offline, watching posts for both adherence to our group ground rules as well as for people that may need to have an individual conversation and maybe some supportive referral in an era where we're all moving to Zoom and WebEx and everything else. When church services that go online have had streakers run through the middle of them, you can understand why we need a moderator. And if you don't know what a streaker is, Jay will tell you. I'm done.
Interesting, lively presentation. I think you've taken us right through a lot of very topical aspects. I mean, many elderly, even pre-COVID, have been experiencing levels of social isolation that we just don't talk about. And thank you so much for highlighting that fact. I mean, I think the example that you shared of your mother was just so hard hitting, and it's definitely something that's really driven home that point as well. And and thanks also for touching upon so many different aspects that I know there's a lot of work that's being done where you are in the US, but definitely this whole concept of multi-generational aged care is a very interesting one. And we've got many people in the audience who I'm sure we have a lot of very interesting questions, about the kind of things that you've touched upon. Please do type your questions into the chat window, and we'll take them up just after we hear from Vidya Shenoy. He's the Secretary General of Alzheimer's and Related Disorders Society of India, and the Honorary Secretary of the Mumbai chapter. And I'd really like to invite you to share your perspectives on social isolation and the challenges that are being faced by elderly with dementia and their caregivers in India. And it'd be great if we can, after this, really talk about what do we do with all this wealth of information that we're getting today. So over to you, Vidya.
Firstly, thank you for inviting me as a panelist. I'm privileged to be speaking with Mike, who is very endearing to me, and I respect him a lot for his experience in the field. This is a very interesting topic in the times where we are going through a very, very challenging phase for not only elders with dementia, and us all. I mean, it's a challenge for us too. So when we talk of social isolation and loneliness, I think they are correlated and often used interchangeably, with social isolation being referred to as little or lack of contact with family, friends, and basically the community at large, or lack of inactivity due to environmental restrictions that now we are going through the COVID phase. Loneliness is something more complex. It's an emotion, it's an expression really of a withdrawal symptom that translates because of anxiety and dissatisfaction that is associated with lack of connectedness or an effect of physical and mental health. A study conducted in India showed that there were about 47.5% who were feeling lonely, with about 65% in urban areas. So the challenge of urban area living and the lifestyle is increasing the level of loneliness. With all the goodness that you have of an urban life, the potential of having a good lifestyle still does impact loneliness for individuals. Now, what I'll do is I'll go through the phases, okay? So, pre-COVID phase and pre the lockdown. So, what I find is that isolation existed even before the lockdown and the COVID phase. Only thing is that we had a choice to evict ourselves of company for whatever reason, or stay at home or be on our own, not socialize. But we still had the option to go out, maybe to the market, maybe to the bank, or shopping, or maybe take children to the seaside or the park, or whatever you do as a family. So also we had an option to be going for seniors group sessions, and where there was total social activity. But what happened after the announcement of the lockdown? The first thing was that it was unexpected. Okay, it was unexpected, creating a fear and a panic situation that was mainly because we didn't know what to do. Our routine was disrupted. And if we had elders in the home or elders living with dementia, it pronounced the problem even more. So nobody knew that this lockdown phase would last for so long, and being distanced with community just because children and elders would be affected by the virus. It was a protective thing that we all were asked to socially distance ourselves and stay indoors. Now, what happens is pre-lockdown, it was a choice we had. During the announcement of the lockdown, we were forced in isolation. We had no choice. So why didn't we have a choice? Because the government felt, along with the medical department and international regulations, that it would spread the virus more and it will be difficult to cope with the problem itself. So isolation has a different connotation for someone who's living with dementia. Because besides feeling that they are lonely, isolation means for them that somebody else is disconnecting them of communication with their friends or their social contacts, reduced interaction, even with family, because families have to be careful, even within the home environment, of being extra careful when they're dealing with, elders with dementia. And just imagine a situation where you have your own daughter or son, or a daughter-in-law or son-in-law, coming with masks, they can't even recognize a person. So it sort of disheartens them, and they're just wondering what's happening around. At some early stage of dementia, you can tell them that, there is a problem and they're looking after your health. But what about people who are in advanced stages or in the middle stage of dementia, where you can speak to them, they might understand, but they are not responding to you, saying that, they've understood what is happening. Third thing is that with low levels of stimulation that occur during this isolation and distancing, the effects on cognitive function is much more, because there's a loss of communication or activity that we normally do for the elders or elders with dementia. It really affects them within, and that stays unexpressed, which gives it is expressed by them in different other ways. So what do we have to do? That we have to, in this stage, have to have person-centered care. Spend as much time with these people, because they should be assured, reassured, reminded as many times as possible that we are there. We are there, we need them, we love them, and that they are indispensable. They may not understand. Elders will definitely understand. But you have to be sincere in that communication, because, one could tell their elder that, oh, we love you, we need you, you're important to us. And at the same time, a body language could mean something else. Okay? So we have to be very careful, person-centered care. And main thing is engagement with the elders and those living with dementia. So we have to, see what the impact of, yeah, you're saying something? I can't hear you.
Jayashree, unmute yourself.
I can't hear you. Yeah, now I can hear you. I can
Great.
hear you.
So I was wondering if you could talk a little bit more about what is the impact of this social isolation on elders and particularly those that are living with dementia?
I'd give a comparison. Like I feel that all fishermen cannot go to sea for the catch. And we are in a phase of repairing our nets of living and lifestyle. This is how I compare it. So we are also caught in the web of social isolation, and for which I think it's very important that we also overhaul our lifestyle with a radical change. Because we have to not only think of ourselves but our families, whether are children, elders, or somebody with special needs, or people living with dementia or disabilities. So we need to remember them. And what I find is that there's a breakdown in the or the disintegration of joint family structures and a rise of nuclear families. So what happens is when there's a rise in nuclear families, the number of caregivers available within the family are much lesser. Okay. And also, I find that, it's a time where we have to remind the elder that they are important, they are our support systems, they mean much more than we have had the time to express. That actually they are indispensable parts of our lives because they not only guide, but they offer us security in an untold way. You see, there is a kind of a fortress they build around us emotionally, which makes us much stronger. So that is very important, and we need them in these, we need them in the normal times, we need them in this time. And what I find is that due to isolation and loneliness, the effects on healthcare, both mental and physical, is much, much uh, more serious than what we make it out to be, because loneliness and isolation can make them so disconnected eventually that there's a very high probability of the person, the elder, going into that form of into a form of dementia, and of which Alzheimer's is the most common. So we have to be very, very, very careful and committed that our elders are made inclusive. Impact of socialization in the lockdown also has had a never ever thought of impact in our lives in unexpected ways. It has made us change. It has made us stop and think. It has actually evolved us. And more importantly, I think situations have humbled us to the point that we are trying to think of others, our elders, and also finding socioeconomic ways to adjust to these new circumstances, which we wouldn't have done. We never think of a rainy day. It's only if we think of a rainy day, it's money. It's not with, something like emotion, which is very, very important as we grow older. So we're thinking of, oh, we must have money, we must have money, but we may not live to enjoy that money. We may not be able to have our elders enjoy the money that they've seen us enjoy. You see, so these are things we need to think about. Elders and persons with dementia also feel lonely and insecure and isolated in normal times. And this kind of isolation disturbs them physically with, their heart, their immune system, their neurosystem, also medical and other medical diseases, and they have a high risk of getting dementia if they are not, enfolded in the family. There should be very, very close-knit ties. We also see that, people with dementia and very, very aged elders have a respiratory problem. So in circumstances of COVID, I think we have to be very, very careful to see that they are not exposed to anything that could, get them infected. Like simple things like, washing hands or wearing a mask, or even, keeping a distance so that they are not subject to or they're not vulnerable to get the disease. And if they have a house help who is not living with them, they don't have to have them enter the house till there are governmentary mandatory instructions that it's lifted, and then you can start your party again. Isolation creates a risk of developing new health diseases also, because distancing does have an effect on the quality of life. Now, quality of life is up to us, how we live it or how we help others live with the circumstances. It also brings a lot of pressure on families and carers. Okay, very difficult to handle. You can have somebody, whether it's a 24-hour care, whether it's a daycare. It's very difficult for family members to live with a person affected by dementia, or a nattering old person repeating the same all the time. You need a lot of patience, you need empathy, you need compassion, you need respect. So unless you have that, it's bound to give you extra pressure, and you have to learn to cope up with this pressure. The elders with dementia also have challenges, as I said, of cognitive function when they are isolated. So it's very imperative that we handle them with TLC, how we say, with tender loving care. So it just changes, it turns the tables in your favor. It makes life easy for them, and it makes your life easy to handle them better. So both you and the elder, or the elder with dementia, lives. We would love to have things made easy. So why not go more than half the way to make it easy for all? We have to also engage them in activity. Activity to keep them busy. They also realize that, it is, they feel very, they feel very happy when you involve them with activity. Keep them busy. Make them do, make them do things which they enjoy. Like maybe discuss, something they love, like when the first child was born. Okay, everybody loves to talk about their first delivery, or ask the male member, what was it like when your first child was born? Were you nervous? Were you worried about your wife? Or were you as, excited? And most men who are now old and talk about their youth being new fathers, would say, I didn't even worry about my wife. I was too excited with the baby. So little things matter to people, okay? And then what we have to do is, it's not necessary that we have to talk. Body language is very, very important. You can have a hand clasp with an elder. You can put your arm around their shoulder. With people with dementia, you can just hold their face in your hands and look at them. It's like a tortoise that looks after the babies across the shores of a river. She doesn't touch them, but that look nurtures the little turtles. So that's the way we see. We have to live life like that. So non-verbal is as exciting and impactful on them as much as verbal is. And tone is very important, which allows them to believe what you're saying is true. Then another issue with elders, I think movement is a sign of freedom. We love to be free. We love to move. We love to go out. We love to go out when we want to. What happens in the COVID phase? We are restricting ourselves and we are forcing that restriction on them for reasons unknown to them. Yeah. So what happens is when you let them know, they don't know why, because they have a ritual, routine. At this time they're doing this. At this time, it's like a daily routine. So they don't understand why everything is getting delayed because everybody is laid back. So they don't understand the logic of your function being delayed.
Yeah.
So with restriction of movement or almost no movement, there's a disconnection again with social interaction or spending time with people they have already spent time with. So this increases their anxiety, increases levels of depression, lowers their cognitive function. Also, with all this, it affects their emotion, though they can't speak, is like that. Even normal elders, we know of so many cases where there is elder abuse. They can't speak, but they're going through it. You see?
Yeah.
So this is the only way where they're reaching out to people. 80% of the time, it's taboo to discuss your problem outside. But it offers them relief for that time, whether it's 1 hour, 2 hours, or maybe even half an hour. They get breathing space to let go of that negative experience just to see their friends. Mobility gives a freedom to them to choose their way. They could go and meet anyone. They could go to the park. They could probably feel that, okay, let me go out on the balcony if I can't get out
Right. Right.
and get some fresh air. It feels good. And
Yeah.
now the monsoons in India, it's nice to smell the earth with
Yes.
the rain. It's a different experience. So we have again sensory effects on people with dementia.
Right.
Elders love it, and they can go, but this phase doesn't allow either any of us to go.
I'm very sorry to interrupt you, Vidya, but I think in the interest of time, could I ask you to just quickly, summarize, in a minute, because I know we have a number of caregivers who are also very interested to share their perspectives, and hear your opinions from them too.
So I'll just be brief. So social interaction, we don't allow them. There's a lot of boredom. There's irritability. There's lack of exercise, which gives them rigidity, no flexibility. Then what do? They express their anger through pinching, slapping, shouting, screaming, because they can't understand why everybody's experiences change with this phase.
Right.
Also, we have to think of comorbidities that are there along with people with dementia. There's a socio-economic risk. What happens when people are at home? They don't know whether their salaries are going to come in full, whether they're going to retain the job. So that worry gives frustrations for elder abuse, which is very, very common in times of COVID lockdown, and also, not will be here more reason for that. So how do we, cope up with this challenge and meet the challenge? So what do? Is we just have to know that social isolation doesn't mean emotional isolation or distancing.
Absolutely.
That's soft spot, and we go a long way. And what are these tools? One is keep them motivated. We let them do what they want, they've never done before. We have to train them. Like most people, elders don't have the experience of being tech savvy. Introduce to them, because we have now won the battle of them actually looking into a phone and talking, as basic as that. So elders can be taught things. They can be allowed to, taught to stream platforms where they make all these holidays and trips without paying for the ticket and hotels. They can go for music programs or see museums and art galleries and all. So these are things that we can help them, feel happy for doing so. Then we all know about happy hormones. So when we play on, the emotional side, we have dopamine and serotonin, oxytocin,
So really about keeping them very
busy
engaged,
and
very
all.
happy. Yeah. Could I stop you there, Vidya, and just ask? I mean, I know you've highlighted a whole host of you've gone from the challenges that that the normal aging healthy elderly are experiencing to the challenges that people with dementia have been facing and the kind of things that one can do to help elderly. But we have a number of caregivers who've joined us today, and I would like to, we have a couple of questions also that have come up for the panelists. But I'd like to very quickly request one of our caregivers who wanted to share a couple of words, Mr. Harish, if I could just request you to quickly share what are your top concerns about social, how do we safeguard elderly during these COVID times? Having heard from both our panelists that socializing is such a key aspect to maintenance of their well-being. What are the kind of concerns that you're experiencing? Harish, over to you.
Oh, thank you. I'm glad to be on. Actually, one thing I'll say is nobody was really ready for COVID-19, right? I mean, we don't have a run book for it. We don't know what to do. I think we're all reacting. We're all trying to do their best. Everybody's trying to do their best. Now, I think every age group in every part of the generation is going through this. But I think for the elderly, it's especially hitting hard. I totally understand that. Um, I live in the U.S. I have a bunch of friends who are in India, and the trouble they're facing is, how do they give care to the isolated, socially isolated elder, to their parents back in India, right? So that's one area. Um, with me, I think we were kind of lucky. My dad was visiting the U.S. and then he got stuck in the U.S. and he's with us now, which is great. We don't have the issue we have about taking care of folks in India, especially without any travel. But we have a multi-generational home now, right? So myself, my dad, and the teenagers around. Now, teenagers want to go out, and we are afraid that they may come back and bring COVID with them. So we're trying to purposely socially isolate or purposely trying to make sure, the teenagers don't go out. So I think that's a dilemma we're going through, making sure there is some guarded social isolation so that, if a 16-year-old goes out to meet some friend, they don't bring something back and make it much more difficult. So I think that's one thing we're trying to. It's like a induced coma, right? I mean, what's the right amount of induced social isolation to protect the parents as well? I mean, that's the big question I have.
So really, I think what Harish is asking is a dilemma that we've heard a lot of our caregivers share, is how do you strike this balance between safeguarding elderly during these COVID times and maintaining their well-being? We know that many elderly are not tech savvy. So yes, technology can provide some amount of support, but what about those who can't, use technology? And how, in families, for example, I know that Mike spoke a lot about the elderly who are living alone, but there are families where you have people who are now resuming their regular activities post the lockdown during the unlock phase in India. And it's a huge challenge that people are facing about how does one go back to their routine lives, knowing that they may be putting their elderly family members at risk. So I just want to very quickly, because I'm aware we only have a couple of minutes left, I will ask you to share your thoughts first, Mike, and then maybe over to you, Vidya. And I know there's a couple of questions in the chat that I would really like us to get to. So could I just request you to respond as briefly as you can? Over to you, Mike.
I think Vidya said it best. When we return to normal, we shouldn't be jump right back into business as usual. Whether it's infection control, whether it's about how I mean, I'll just speak on a policy level. In my country, for example, long-term care and caregiver support issues have risen on the agenda because all of a sudden people have had the experience. So I think if you read, there's a lot of plague literature out there. The classic is Albert Camus, The Plague, that I think everybody read in college. But, there's a lot of, every culture seems has some fictional account of a plague like this. And all of them talk about some change of heart about how we approach life, and that we just don't go back to life as we we're trying to forge the new normal, and maybe and the key word in new normal is, what are the norms? Does this bring back more respect for our freedoms? Does this bring back more respect for our elders? Does this give us a way to go to our bosses and say, you know what, damn it, I'm not going to commute because I've got an elder at home and children in school, and somehow we made it work during COVID. We're going to keep making it work because I value my elder that much. So I just look for the sign, look for the change that you've been through, claim the good part, and push. I think that's what's going to happen.
I think that's really well put. I mean, about creating a new normal and really looking at how we can learn from these experiences. So what are the lessons that need to now redefine the way we live post-COVID, probably with a lot more sensitivity towards our elders. Vidya, if you could just quickly respond with your thoughts. I think, Vidya, you're on mute.
It's an opportune time for us to overhaul our systems mentally, and of course, it's going to be physically too. It's a kind of ordinance we've got from the Supreme that says stop, observe, change, if you want to enjoy life. Okay? And I will just not take more time. I'll just tell you, I'll close with the quotation by Peggy Rubin, who says, an exciting, once in a lifetime journey, this is the phase I'm talking about, to authentic change inside out. You will enjoy this joyride. So let us enjoy this joyride, giving the best to the people who've given us the best in the past. Look around for even, we are in a family, a big family, a community. So let us remember those who cannot remember and make it dementia friendly all over. Yeah, thank you.
Great. I think we have time for one question for Mike. Could you tell us more about what is being done or considered to help single person households where the person has dementia? So I know, Mike, you already spoke about the online community and the kind of awareness support that that you spoke about. But anything else that you would like to add?
I should have answered everyone in the chat. Sorry, I just answered the gentleman, Swapna, who asked the question. So we've established a Facebook group to be a safe place for people to find, in this circumstance, to find information and emotional support. I say safe place because frequently the response when person reveals that they are a person with dementia living alone is that people want to violate their rights by protecting them, forcing them into aged care communities, forcing them to have guardians. So we've created a safe place for people to talk with each other. We're also assisting action planning at the community level to both develop these crisis tables, but also to look at the long term, look at alternatives in housing and into alternatives in how existing elderly housing, which by itself is very isolating, can be repurposed and improved.
Thanks, Mike. I think I mean, this has been a really fascinating discussion. I know that with the wealth of experience that our two panelists have, this is just really the tip of the iceberg. So I mean, we could go on forever just discussing this and, talking about the kind of, the challenges about social isolation, not only with people who have dementia, but for elderly in general. The way that COVID has really just brought this to the forefront, with elderly being so, one of the target groups. I mean, I think in a way, if we have to look at the positives of COVID, one of them really is that people are sitting up more and talking about elderly related issues. People are now recognizing that we need to do more to support elderly, to look at the kind of challenges that they're facing. And hopefully this is going to push for more momentum. Both of you talked about more inclusive communities. Both of you touched upon awareness. You also touched upon destigmatization of various, neurodegenerative disorders and mental health related issues. And I think all of these are really this is just touching on the tip of the iceberg, as I said. So with that, I mean, I think I would like to thank you both for joining us today and sharing your insights on this, this topic, which is, I mean, I don't think we can get answers from a short webinar like this, but definitely this is something that through this webinar, we're really hoping, as part of Samvedna's work, is not only to provide support for seniors with neurodegenerative disorders and mental health conditions, but also to create awareness about elderly related issues. So I really think, to that effect, it's been a truly fascinating session, and I want to thank you both for joining us, and I want to extend my thanks to each and every one of the participants who's been with us today. It's been really great to have you, and I wish that we would have had more time to take questions, but just listening to the wealth of experience that our two panelists had to share. Unfortunately, our third panelist wasn't able to join us today due to a sudden medical emergency, but I think we've, it's really got us thinking. It was great to hear the passion with which you spoke about the kind of work that you're doing, and it's truly very inspiring. So thank you all for joining us for this webinar. Thank you very much.
Thank you.
Thank you.